911, what's your emergency?
I am Officer Erin Nordrum. I'm a police officer in St. Louis Park, and I am currently assigned as the behavioral health officer.
And I'm Leidy Cortes Arrington, the embedded social worker at the St. Louis Park Police Department through Hennepin County.
I'm Kris Olson-Ehlert. I am the alternative response medic for the City of St. Louis Park Fire Department.
So a call would come into our dispatch center. If it's someone that we've had past contact with that have had behavioral health incidents, then they may dispatch the behavioral health officer. All of our officers are highly trained in de-escalation. It's something that we do every day, all day long. The difference, what this unit can do, is offer time. Someone who's experiencing a mental health crisis, it takes time. Someone who has suicidal ideations, someone who uses alcohol or other illegal drugs as a coping mechanism or self-medication, not appearing normal to family or not feeling normal themselves, know that something is going on, something is wrong, and they call and need help. I can explain to them about our embedded social worker, about our community paramedic that we have on staff. Most importantly, I can tell them, I'm going to sit with you. I will follow up with you. These are some things I can do with you moving forward. I'll check in on you. These are some of the supplies we use when we're out trying to meet people. We usually put 3 to 4 snacks in the bag and then a bottle of water, and then we'll have a handout for resources for people who are unhoused. There are blankets, diapers, we even have pregnancy tests, some kits with shampoo and conditioner and things like that. Build some rapport with people. It's a way to start a conversation. If you're hungry, you want to focus on your basic needs. Until your basic needs are met, it's kind of hard to focus on anything else. And so anyone who's willing to walk to an ambulance or come into my squad car and get a ride to a hospital, or are willing to work with our embedded social worker, willing to get resources, that's a success.
As a Hennepin County social worker, I can help people with mental health concerns. So if they wanted to get connected with a therapist or a psychiatrist, or longer term therapy, like an intensive outpatient program. Some other concerns that I've seen a lot are housing concerns. So whether that's paying for rent or finding somewhere to live that's more affordable or that offers more support that they might need. And then benefits to the county. So like SNAP, food resources, childcare assistance. So I can help people fill out applications for county resources. A lot of the people that I come into contact with through the police department maybe haven't had the opportunity to get connected with the county or a social worker in other ways. So I'm able to reach a different group of people. I have the benefit of working with police officers where that's their specific role, and also having that connection to the medical community through the paramedic.
As the alternative response medic, my primary role is doing home visits, referrals, follow-ups on people who have called 911 or people that we have concerns in the community, try to connect them to resources. I do respond to 911 calls in between those things. So I carry a typical things you would see in the ambulance. I have a Zone monitor, cardiac arrest bag, oxygen. The way that my services get involved in a call is generally the firefighters will go out onto an emergency call and they'll identify needs for the individual. They will then put a referral into me, and then I will work on contacting the patient to go out and do follow-up and try to connect them to the services, trying to prevent people from falling in between healthcare gaps and getting them maybe get connected to a case manager, might be making primary care appointments for them. Maybe it's substance abuse, helping them get connected to resources for that. Our healthcare system is very complicated. Some healthcare gaps may be the individual who's using the emergency room as their primary care, medical issue such as diabetes, COPD, things like that that are chronic. We want to try to get those people into primary care to make sure that they stay healthy. We want to try to keep people in their homes people tend to do better when they're in their homes than when they're in healthcare settings. Since there's a huge number of aging population in St. Louis Park, the fire department does a lot of falls, so we try to reduce that, so that one, it reduces the strain on the 911 system, but also falls are dangerous for our elderly community. Falls are some of the leading causes of death in elderly in the U.S. So we want to try to prevent those falls and injuries. And so going out, I'll do a home assessment, make sure you don't have area rugs, make sure that you have grab bars in your bathroom, making sure you're riding the right shoes, things like that, so you don't slip in the home, and that your home's not also cluttered, so you have paths to be able to get through your home. Anything that would make your home safer for you to stay in your home long term.
So we are patrol officers. I mean, our main function would be patrol, but we have received specialized training. I have been a police officer for a significant amount of time, same as my partner. So we come with a lot of wisdom and expertise in that. And I think how we build rapport is just by showing up. I've driven people to doctor's appointments. I have picked up prescriptions. I have contacted family members of someone when they've been estranged for many years. We've helped elderly people get into different kind of housing situations. Someone who may be struggling with some mental illness and is in a group home, we'll go to a clothes closet with them. When you don't have a prescription or you can't get to an appointment, and I say, I can drive you, that goes a long way, because that's what people are facing. By wearing a soft uniform, having an unmarked squad car, going in with a social worker, and all the things that we can do, it just alleviates that stigma. So we just kind of help them where they're at.
The goal of my position is to improve health and access to services for people living or staying in St. Louis Park. Doing my role by myself, just as an alternative response medic, I need those other stakeholders to do my job well. If there's an identifiable need and someone refers them to a program, we work to connect them to those services. If we don't have the ability to do that, we try to hand that off to someone else that can help them.
If I was working with someone and they told me that they don't have a primary care doctor or they needed to go see a specialist, then I can reach out to the alternative response medic and say, hey, do you know what the process is to get into this? And on the flip side, he can work with people who might have some medical concerns, and oftentimes there's behavioral health concerns, or they need help with their housing or economic assistance, and that's kind of when he brings me in.
I get to work face-to-face and work every day with a social worker who has a long list of resources and a different viewpoint than I have, correct? Processes such as adult protection and child protection, she's the expert in that. I come with a certain number of tools, she comes with a certain number of tools. So it makes our bucket of tools bigger.
I think what we're doing in St. Louis Park is really unique. We're filling a lot of needs within the city, and I can see this being a program that other departments want to emulate.
If it's an emergency situation, I would say call 911. Otherwise, call the non-emergency line.
952-924-2618.
If you're struggling and you just don't know where to start, give us a call and we can assist with that.